Every day, countless individuals experience discomfort that leads them to question the cause. Is it a pinched nerve or a muscle strain? Understanding the distinctions is crucial for effective recovery. Let's demystify these conditions and guide you toward relief and healing. Let's begin with a pinched nerve. This condition arises when surrounding tissues exert excessive pressure on a nerve. Often, this pressure comes from bones, muscles, or cartilage. The consequence: pain, tingling, numbness, or weakness in the affected area. Imagine feeling an electric jolt radiating from your neck down your arm, the hallmark of a pinched nerve. On the contrary, a muscle strain manifests when muscle fibers are overstretched or torn due to sudden overexertion or injury. Picture the discomfort following an intense workout where you've pushed beyond your limits. A muscle strain often brings localized pain, swelling, warmth, or bruising, less diffuse than its nerve counterpart. Recognizing the signs and symptoms can help you differentiate between the two conditions. When dealing with a pinched nerve, the pain is frequently described as shooting or radiating, potentially extending into the arms or legs. You may find yourself struggling with movements that exacerbate the pain or lead to sensations of weakness or tingling. In contrast, the discomfort from a muscle strain remains centered in the specific area of injury. You might feel stiffness or tenderness that intensifies with movement or touch, but the pain generally doesn't radiate beyond the localized region. For many, that unmistakable difference can guide you toward the appropriate treatment. When it comes to addressing these conditions, your course of action will vary. For a mild muscle strain, remember RICE: rest, ice, compression, and elevation. Integrating gentle stretches can facilitate recovery once the inflammation subsides. Don't rush, as patience is key. If it turns out to be a pinched nerve, avoid movements that worsen the discomfort, while over-the-counter medications and gentle stretching might provide relief. Should severe pain, weakness, or long-lasting discomfort arise, reaching out to a healthcare provider is paramount. In conclusion, gaining clarity on the differences between a pinched nerve and a muscle strain is the first step towards effective healing. Listen closely to your body's signals, take proactive measures, and seek medical guidance if something feels off. Your path to comfort and recovery starts with knowledge.